So are we live? It seems we are live. Let's just have a look once, recheck. Today's a very special session. Today's a super special session because it's been on demand. so let's just check if we are complete. If we are live, then probably we can go ahead with it. Yes, we are live.
Yes, Shilpa, we are live.
Perfect. Good evening, everyone. Welcome to Endo Crusaders, another session on endometriosis awareness. And I'm Dr. Shilpa, and with me is Dr. Vimee Bindra, and we are creating awareness about endometriosis. So today's session is extremely special because it's on demand. Ask me anything. One question I want to ask everyone. So do you know what's common between Hillary Clinton, Marilyn Monroe, Padma Lakshmi, Susan Sarandon, Whoopi Goldberg, and Gillian Michaels? No. Besides being female by gender, these celebrities have struggled with something known as endometriosis. Endometriosis, as we have been telling everyone since the day we began this page, that it's a very common disease and it affects about 10% of women worldwide. So according to the Endometriosis Foundation of America, endometriosis affects about 1.76 million people worldwide. And it is royally misdiagnosed and mistreated. So today, Dr. Vimee and I are going to answer all the questions you have sent us by mail or on our direct messages. Hi, Vimee, how have you been?
Hi, Shilpa, how are you? Hello, everyone.
I'm good, surviving with endo. All okay. All okay. So far, so good. So should we begin the session?
Yeah.
So Vimee, first and foremost, what exactly is endometriosis and what, where all can endometriosis happen?
We have discussed this in every session almost, like endometriosis by definition is implantation of endometrial-like tissue or similar tissue to endometrium outside the uterus where it does not belong.
Correct.
And Shilpa, you asked me where all it can happen. It can happen anywhere in the body. So there is no relation with the reflux menstruation or backflow of menstruation which causes endometriosis, because endometriosis has been found in the skin, abdominal wall, where the reflux menstruation cannot explain it. So there is a lot of genetics and epigenetics which plays in the causation of endometriosis. So the most common involvement is the pelvic areas, where the ovaries are the commonest involvement, peritoneum, bowel, ureters, bladder, and the pelvic structures. But extra pelvic location is not rare and not uncommon to find. Nowadays, we are seeing a lot of diaphragmatic endo and even thoracic endo. A lot of extra pelvic location endos are very, very common, of which abdominal wall or scar endometriosis is very common because of increasing cesarean section rate. We are seeing a lot of scar endometriosis as well. So it can happen in any part of the body, but most common location is the pelvic.
So it will not be wrong if we say that it's a whole body disease. It is just not a reproductive disease, as it has been said for a long, long time. This needs to change. Endometriosis is a whole body disease and it needs to be treated accordingly. Not just...
It is also called whole body disease because it does not only affect the reproductive system, it also
Correct.
affects the because it causes fatigue, bloating, and many of the generalized symptoms which cannot
True.
be specific to any organ system. So it
True.
is a whole body disease. It has a lot of associated effects in terms of mental, emotional, social well-being as well. So definitely it affects the whole body.
True. So coming to the next question, what exactly happens in endometriosis? In the sense, what are the symptoms? These are the basic questions we have been getting from people. So what exactly are the symptoms of endometriosis?
See, endometriosis has a variable presentation. 50 to 60% of the women can have painful periods. 40 to 50% of women can have infertility. And there is a subset of population which can be absolutely asymptomatic, and they're only detected when they are undergoing surgery for something else or some other issue, or if they are planning for pregnancy, they are detected with infertility, so they become symptomatic for infertility. So most common symptoms are painful periods, the pain Period pain may be before periods, during the periods, after the periods. That is also called as triple dysmenorrhea, congestive type of dysmenorrhea. Some women may have chronic pelvic pain. Throughout the cycle, they may have pain, bloating, fatigue, dyschezia, dyspepsia, painful urination, dysuria. So it also depends on which organ is involved, where it is impacting. So your symptoms may vary depending on the organ involvement. So it causes a lot of symptoms. Bowel symptoms are most prominent along with the painful periods. Because
Makes sense.
Yeah, that's the most common reproductive site, I would say, which is involved. So constipation, painful defecation, blood in bowel movements. So all these symptoms are very common.
Makes sense.
Painful intercourse is one of the symptoms which I should mention, that many women have painful sex.
Correct.
So that is very important because most of the patients of endometriosis have uterosacral involvement and they have painful bowel movements and painful sex both. Any examination also elicits pain. So these are different pain locations which should be addressed. So when we elicit history from the patient, we ask about different kind of pain, and also we score them on visual analog score, like how do they scale their pain from 0 to 10, so that in case they are given some surgical treatment or they have taken some medical treatment, so we can compare how what is the improvement in their pain symptoms.
Absolutely. Also, alternating diarrhea and constipation is one of the prominent signs of endometriosis. Correct me if I'm wrong, huh, Vimee?
Especially bowel endo.
Yes. And migraines are severe because of the estrogen dominance. And also endometriosis patients have a lot of sciatic and or leg pains, if we can say in common terms. It is extremely common in patients with endometriosis. And also the amount of pain a woman experiences is not necessarily related to the severity of the disease. You know, a woman can have a grade 1 disease and may have severe pain vis-a-vis a woman with a grade 4 endometriosis having no symptoms at all.
Definitely.
Right?
Staging of endo does not correlate with the symptoms. We have seen patients who have only stage 1 or 2 endometriosis and they can't even walk. And stage 4 endometriosis patients may be absolutely asymptomatic and they're detected with the stage 4 when they're trying for pregnancy or they come.
Correct.
And also some site-specific endo will have different symptoms. Like if you have a diaphragmatic endo, you may have pain during breathing, you may have in thoracic endo, you may have catamenial pneumothorax, and abdominal wall endometriosis, you may have pain at your cesarean scar or surgical scar site. During periods, you have pain there, abdominal wall pain. So these are the symptoms according to the site of endometriosis.
So all in all, you name it, you have it. You know? So what is the general time taken to get diagnosed with endometriosis?
Yeah, the delay in diagnosis is prevalent globally. It's not only in India or any other country. It's a global phenomena where diagnosis of endometriosis is delayed because normalization of period pain is very, very common. Not only by patients, even the doctors also normalize period pain, which should not happen. That is a major reason for delay in diagnosis. Correct. And also, it is not like picked up by sonologists or radiologists. So they are dismissed. They are told that nothing is there and your pain is normal. So this is the main reason for delay in diagnosis. And on an average, it may take 6 to 7 years or up to 10 years once the woman is diagnosed with endo. But with increasing awareness, we are trying and we are raising awareness, and patients are coming up now early, within 1 to 2 years, or also they're getting diagnosed.
Yes, true. Early diagnosis is the key, so that you don't lose more organs to this disease, you know. So
and when we talk about women, fertility is a major issue where women have to think about it. Definitely. Correct. The families are involved. So if it is delayed diagnosis is there, their ovaries are getting damaged, their ovarian reserve is coming down along with other organ damage. Definitely. True.
True.
So
Obviously.
early
Because
diagnosis will give them definitely, we can save their organs, we can save their fertility, we can save their kidney damage, bowel damage,
and
and
also because it's a progressive disease and it causes a lot of inflammation. So it obviously needs to be addressed at the first go. Uh, as we just said, a lot of times women come only because they have problems conceiving. So how is endometriosis and infertility related? I mean, does endometriosis mean infertility?
no, definitely not. And endometriosis does not mean infertility, but yes, 40 to 50% of women with endometriosis may not be able to conceive. It affects infertility in various ways. One is it affects the ovaries, forms a chocolate cyst, damages the ovarian cortex, reduces ovarian reserve. So egg quality and number of eggs both come down. Second is it alters the pelvic anatomy, which is the normal anatomy required for the transport of egg, pickup of egg, and fertilization, which may not happen. Sometimes it might block the tubes as well. Blockage of tube is not very common in endometriosis because we have seen the tubes are usually patent, but ovaries are badly damaged. So alteration of anatomy, oocyte quality, number of eggs, all these get affected by endometriosis. And by the time patient comes to us, if they have stage 4 endometriosis, almost their ovarian reserve will be very less in most of the cases. Definitely, excision surgery enhances spontaneous pregnancy rates. And we have also seen patients who have conceived with endometriosis without any treatment as well. So spontaneous conception also happens. We are not saying that that does not happen. We are talking about the patients who report to us. We are talking about the patients who get treatment. We are talking about the patients who undergo surgery. So there are patients who have conceived and when they undergo a cesarean, then the doctor finds out that they had endometriosis. So spontaneous conception is also possible with endometriosis. And it's not that every endometriosis patient is infertile and they can't conceive. So they can conceive. 40 to 50% of the patients may have infertility issues.
So the good news is 40% of women conceive spontaneously, so no problem. So there's some positive thing to talk about endo. So there's this question again, which is very relevant. CA125, supposedly one of the markers for ovaries, right? So can you have a CA125 of 165 in endometriosis?
Absolutely, yes, Shilpa. Endometriosis, CA125 is not an absolute marker for endometriosis, first of all. And yes, it can be elevated. It can be elevated in many other conditions also. True. If you do it during the periods, it can be elevated. And in endometriosis, 165 is absolutely a normal figure. Yeah. In endometriosis, we have seen CA125 up to 3,000, 4,000 also, and it was not cancerous. Yes, it was not cancerous. So elevated CA125, don't get scared. We have seen patients who were told that you have cancer, laparoscopy cannot be done, you will end up with open surgery. So this is not true, absolutely not true. Because of a lot of inflammation and tissue changes, this CA125 may be elevated in endometriosis patients. And really nothing to worry. If somebody is telling you that it could be cancer with 165, you need to have one more opinion.
Second opinion, true. Also, how can one know if they have endometriosis? Can MRI tell, or laparoscopy is the only way?
Endometriosis can be diagnosed by the first is like a clinical history. If I talk to the patient, I can make out from a lot of listening to the patient and making out their pain generators and their symptoms. Second is ultrasound is a very good tool. With a high resolution ultrasound, we can pick up even early endometriosis also. If not, then MRI. Earlier, it was believed that only laparoscopy is the thing where endometriosis can be diagnosed. So it's not like that. If you have a good sonologist or your surgeon only does the scans, then it can be picked up on scans. Even the complete mapping of the disease can be done. And it also gives a roadmap to the surgeons where surgeon can perform laparoscopic and be ready with a multidisciplinary team to address the bowel and ureteric endo as well. So it can be picked up on ultrasound. If more details are needed, then MRI may be advised.
True. That's something a lot depends on the radiologist that you have, who's doing
Yes,
your the sonography or the MRI.
absolutely.
Uh, is adenomyosis considered to be its own disease, or it's a kind of endometriosis?
Adenomyosis definitely. We do also call it as a sister of endometriosis. This disease is almost same as endometriosis, but the only difference is it happens in the uterus.
Correct.
Now, there are two theories which explain the existence of adenomyosis. One says that there is a from inward to outward growth of the endometrium in the muscle layer of the uterus. And another theory says that there are pluripotent stem cells in the muscle layer of the uterus which give rise to adenomyosis. So it is a disease confined to the uterus, but yes, it also presents with painful periods, infertility, subfertility, abnormal uterine bleeding. So these are the issues associated with the adenomyosis. The difference between adeno and endo is completely outside the uterus. Adeno is in the uterus. That is why we say hysterectomy does not help endometriosis and hysterectomy does help adenomyosis.
Adenomyosis.
Yes.
So the next is, I have 3 ovarian cysts and I have pain that is one-sided. I'm not aware much about endometriosis. Will it be cured?
There is no permanent cure for endometriosis, but definitely a good excision surgery. The recurrence rates are very less and it gives you a good quality of life.
And is there any way you can prevent your body to make cysts?
There is no preventive method to not to make cyst. Only one disorder, which is called as polycystic ovarian syndrome, which can be prevented by lifestyle changes. But these cysts, which are the pathologies in the ovary itself, they have a lot of genetics and epigenetics role playing in their existence. So it cannot be prevented, but yes, it can be managed if detected on time.
If only there were ways of preventing these cysts, I think life would have been much easier for a lot of people. Yeah. Okay. So is it possible to have pain in the area even after the surgery?
See, if you're talking about immediate post-surgery, then yes, the soreness and the inflammation from surgery or the mild surgical adhesion, post-surgical adhesions can cause pain in that area. And if it is a delayed pain after the surgery, it may be because of the fibrosis resulting from adhesions or some residual endometriosis. It depends on the case, like where we are talking about this pain. What are the pain generators? It is a pain arising from the nerves or it is pain arising from the residual endo. So we need to evaluate further to answer this question.
Okay. So what are the factors to be considered when to go for an excision surgery?
First of all, you need to know where all the endometriosis is there. If bowel endometriosis or any extrapelvic sites are involved, whether the doctor has the multidisciplinary team or not. So that is the most important part. And because first surgery, I always say, has to be the best one and it has to be the complete one. It should not happen that you have ureteric endo and the urologist is not available.
Correct.
So your excision expert should have a multidisciplinary team where they can address all kind of endo. This is the most important part of any endometriosis surgery. And then comes the all discussions, what will be the preoperative preparation, how much stay in the hospital, post-operative recovery, morbidity, and how much time you take to recover. And what are the complications you may face, you need to discuss depending on the case.
All right. And how much time does it take for a healing after an excision surgery is done?
After an excision surgery is done, the complete healing, if you ask me the internal healing, it takes 2 to 3 months, which is like average of like 6 to 8 weeks. And if we do laparoscopy, actually you will be ambulatory next day only. You will be made to walk and you can do small stuff as well. And within 1 week, you can resume your activities also. So complete internal healing might take 2 to 3 months.
2 to 3 months, right? With endo or Eddino, how much IVF is suggestible? What to expect during IVF in the sense chances, inflammation, etc.?
See, there is no proper guideline that how many IVF cycles. It all depends on your Eddino and Endo staging and the ovarian reserve and your AMH levels, and also your reproductive specialist. Now, there is no guideline, proper guideline that this many cycles should be done. But in case you have endometriosis, I would always suggest that if your AMH is low, go for freezing, go for surgery, and then transfer. If your AMH is fine, go for excision surgery and then go for IVF. So these are the ways where we can safeguard your fertility potential when you're going for surgery.
Okay. The next one is, can we open blocked fallopian tubes with laparoscopic procedures?
We can open block fallopian tubes by fallopian tube catheterization, which is a hysteroscopic guided procedure with the help of laparoscopy. But only proximal tubal blockages can be opened, not the distal tubal blockages, which are mostly hydrosalpinges or in which the tube is badly damaged. It doesn't work. Only opening the tube is not important. The functionality of the tube is also important. So proximal tubal blockages can be opened through fallopian tube catheterization.
Okay. With bilateral endometrioma and age 33, what does AMH level 6.1 suggest?
Bilateral endometriomas with 6.1 AMH, I would say that AMH is a little on the higher side. So there may be a combined pathology like polycystic ovaries coexisting with the endometriosis. In PCO, AMH will be on the higher side, and in endo, AMH is on the lower side. So if it is little on the higher side, we also should suspect about a dual pathology.
All right. With bilateral cysts and very low AMH, what's the most suitable treatment? Excision first, then IVF, or just go with IVF? We just answered that, I think.
It also depends on the size of the cyst. If you have huge endometriomas, 6-7 centimeters endometriomas, then IVF is not possible. In that case, you have to go for excision surgery, and then depending on the post-excision, how much is your AMH or the antral follicle count, we can decide whether you can do it with your eggs or donor eggs are needed for IVF. And if endometriomas are small and AMH is low, in that case, we advise you to go for oocyte pickup and embryo freezing and then go for surgery before transfer.
Okay. Scar endometriosis 1.6 millimeter. Would a surgery help?
Yes, any scar endo surgery will help.
All right. So the next is bowel endometriosis. No, rectum. Endometriosis in the rectum. What are the symptoms?
A lot of symptoms can be there in rectal endometriosis, where first is painful bowel movements, passage of blood in during the bowel movements. Painful sex is also one of the symptoms. Dyschezia, tenesmus, feeling of incomplete emptying of bowel movements, stools, alternate diarrhea and constipation. Only constipation. So these are the common symptoms which bowel endo can present as.
All right. Once a scar excision surgery is done for scar endometriosis, what are the chances of recurrence?
Scar endometriosis.
Yeah.
If complete excision is done with the clear margins, then chances are very less, maybe I'll say less than 0.1%. But in case it is incomplete excision, then recurrence chances can be as high as 25%.
All right. There are a lot of questions which have come in. Stage 3 endometriosis with patent uterus and tubes. Still, I'm unable to conceive. Why?
The stage 3 endometriosis with patent tubes, as I said, tubes may be patent in many of the patients with endometriosis, but pregnancy or occurrence of the fertilization depends on a lot of factors like the egg quality, the inflammation, the receptivity of the uterus. So there are so many factors involved. It's not only the patent tubes or presence of ovaries which gives rise to fertility. It's the complex interplay between all the factors. So any of these factors may be responsible, which is hampering your conception.
All right. Interesting question. What are your thoughts about leupride injections, long-term side effects, and
you don't even think about leupride, Shilpa.
I know, the worst kind of a drug ever made for the mankind.
Today, only one patient had come. She has already done excision surgery, but prior to excision, she was given 3-4 doses of Leupride, and everywhere she had joint pains and body pains and all. So I think that was the Leupride side effects which she was facing.
True. So I'm like a live example of Leupride injections where you have pain. Hello?
I could not hear you for some time.
Am I back?
Yes, you're back.
All right. So I was saying that I'm a live example of Leupride injections given and having a long-term side effects. Trust me, the side effects of Leupride injections are irreversible. The bone pains, the joint pains are something which the bone loss that you develop is terrible. So I think this is one of the worst possible medicines ever. So try not to take it as much as possible. That comes from a patient who has gone through it. So somebody has just said, I find your page very informative. A lot of things I wish I knew 10 years earlier. We're so glad. So glad about it. See, I've got questions about adenomyosis also, but then I think we'll cover that in the next, Ask Me Anything, because otherwise the session is going to be like really long. All right. Okay. So is endometriosis possible even after menopause?
Yes, endometriosis can happen at any age of a patient's life. Teenage endometriosis can be there. Earlier, it was believed that endometriosis only affects the middle-aged women, and it does not affect the adolescent girls also. So adolescent girls and menopausal ladies, they can also have endometriosis. So we have seen many patients who had done a hysterectomy and they came back with the pelvic pain, and on evaluation and on laparoscopy, we found a lot of endometriosis was there. Correct. So there is no age which is spared where endometriosis cannot happen. Endometriosis has been reported in newborns. Endometriosis
exactly.
in the fetus as well.
True.
So no age or no.
This can be as crazy as it can get. Newborns having endometriosis already, that can be like terrible. So what's your take on psychotherapy post and pre-op as a care of endometriosis treatment?
Endometriosis is a multidisciplinary approach. Psychotherapy or psychological counseling is a very important part of endometrial management, because these patients go through a lot of stress and dismissal and invalidation. So they really need these counseling sessions to help them manage this better pre-operatively as well as post-operatively. So psychotherapy is important because women who have this endometriosis, not only they have physical problems, they have emotional as social and marital issues as well. So it has to be a very, very important part of our team management, where women need to vent out, they need to talk, they need to discuss, they need to understand, and they need to help cope up with their symptoms and how they can manage it better. So psychological counseling and therapy must be a part of endometriosis team management. Without that, it's very difficult to manage endo patients.
Absolutely. And also because even after the surgery, the pain just doesn't disappear. It needs, and somebody going through a chronic pain expects that, once a surgery is done, it's like a magic thing, but it is not the case, So it takes time. You have a lot of things to go for, and only then the pain gradually comes down. So I think to manage chronic pain constantly, you need, and these patients are more prone to depression. So it is at most important to have a psychological counseling for those patients. It's really helpful. So hormones play a very important role post-operatively also. So what are the various hormonal treatments post-operatively?
So in our practice, we usually use progesterone-based therapy, especially the Dynogest, which is most commonly used, and oral contraceptive pills, or we also recommend Mirena in some cases where associated adenomyosis is there or abnormal uterine bleeding is associated.
Okay.
These are the most common hormones which we use in practice, and GnRH analogs are widely used everywhere, we usually don't recommend that.
Makes sense. What's the treatment option for endo-ovarian chocolate cyst?
Chocolate cyst, laparoscopic endometrioma excision.
Okay. I got DNC for 9-week fetus. After that, I got cyst endometriosis. Are these all due to abortion?
No, I don't think it is related. Maybe the cyst was already there, which was not picked up. And suction and evacuation has nothing to do with the endometriosis development.
Okay. How do you treat endo and adenomyosis in a young girl, maybe around 23-year-old?
Adenomyosis is basically first line. It is a stepwise protocol. Basically, we start with the medical therapy, and then we go for the conservative surgical treatment, and then the definitive surgical treatment. Unlike endometriosis, where the surgical treatment is the first option. So, in a young girl, a very young girl who is having painful periods or heavy bleeding, first option would be the hormonal. Or the hemostatic agents along with the analgesics. Then second option is the hormonal oral contraceptive pills or progesterone-based therapy. Otherwise, Mirena can also be offered if none of the hormones work. And if nothing is working out, then conservative approach can be applied. We can do adenomyomectomy, where the adenomyoma is removed, or if it is diffuse adenomyosis, uterine debulking surgery can be done.
All right. Is excision surgery the only treatment for endometriosis? And would I be pain-free after the surgery?
Endometriosis, worldwide by several studies, it has been shown that excision is the best treatment as of now. And as you asked, pain-free, then endometriosis excision is only a part of it. There are a lot of things involved post-operatively. A lot of lifestyle changes, dietary changes, pelvic exercises, as there are a lot of pain generators which causes pelvic pain. So it's not only the endometriosis, there can be other pelvic pain generators also. So there is no magic wand or something which we do in excision that you will be 100% absolutely pain-free. That is not the case. So definitely your pain improves if endo is only the cause, but if there are some associated causes or some other pelvic pain generators, then definitely you need to have more, what would I say, the holistic treatment options, which will help you cope up with your day-to-day activities.
All right. Someone asks, after scar endometriosis excision surgery, would the periods be normal and pain-free?
If you do not have associated pelvic endometriosis, usually scar excision, complete excision gives you complete pain relief. And periods will be normal because if you had normal periods earlier, provided. Because no surgery is done on your ovaries, we are not touching your ovaries. The scar excision, scar endometriosis is on the abdominal wall. So if that is removed, your period should be fine as usual.
All right. So I think we're almost done. I think there's one more question which is there. Endometriosis, spinal or back endometriosis, do they show up on an MRI?
See, MRI can pick up a lot of endometriosis. So if your sonologist is good at reading MRIs, they should be able to pick up.
So
I
that's
have a question for you, Shilpa.
Okay.
It's you being an endo survivor, you're a real fighter, I know.
Thank you.
So she's asking, it's about diet and endo. She's a vegetarian, so she eats a lot of tofu. But she's finding conflicting information about this. Some say the soy is estrogen mimicking and bad, and others say it's an anti-inflammatory and beneficial. So True. What would you like to suggest, Shilpa?
So there has been a lot of debate about it, Vimee, about soy and endometriosis. So basically, soy contains isoflavones, right? So these are actually estrogenic compounds which are found in the plants, but they don't really act just like the estrogen which is produced by the body, and they don't increase the C-reactive protein, okay, which is an inflammatory marker. So phytoestrogens actually can be estrogenic and anti-estrogenic also. What do I mean by that? When the body produces more estrogen, it acts as an anti-estrogen, okay? So, and that decreases the level of estrogen, the free estrogen in the body. And if the estrogen levels are very low, it binds to it. So that's how it works. So don't fear taking soy, the soy products, because it actually reduces the inflammation if it has come from a natural source. Okay, organically produced soy will give you good results. Okay, but saying that nowadays, since a lot of things are like, mixed, that's the reason, there's this conflicting thing happening. Some soys which might aggravate the symptoms can be soy milk, soy protein isolate, soy-based meats, ice creams, and also soybean oil. Not because of anything else, because they are high on FODMAP. All right, and as we all know, we need to have more of low FODMAP diet, right? So otherwise, you can have soy. That's not a very, very big problem. And what I would also recommend is talk to your dietitian about it, make a diary and see how it works for you, because every diet is different for every person. It's a personalized thing. What suits me may not suit you, so if you think soy is not creating a problem for you, it's not creating any flare-ups, you might as well go ahead with it. There's nothing that you really have to get worked up about.
Yeah, that was quite informative, Shilpa.
Thank you.
As an endometriosis survivor, would you tell us some tips and how best you can manage yourself with endometriosis, how to live with endometriosis?
First and foremost, mental strength is something which is of utmost importance. You need to be mentally very, very strong, and you need to push yourself every day, because it's not easy living with pain. The days which are like extremely bad, listen to your body and just try to relax yourself, and take one day as it comes. Don't compare yourself with others who are like extremely healthy and are doing things, and don't compare yourself with them thinking that, okay, fine, I mean, they are able to do so much and I'm just not able to do my routine jobs. That's something which will just get you into that cycle of depression. So try not to compare yourself with anyone. Your journey is your own. It's not somebody else's journey. They don't know what you are going through. Talk to the people that you love. Tell them what you're going through, so that they understand. They're not God. They'll not know what you're going through until and unless you tell them what you're going through. Third, make heating pads your best friends. So generally, 2 heating pads does make a lot of difference. One on your stomach and one on your lower back, which are the most painful sites for majority of endometriosis patients. I cannot emphasize enough on pelvic physiotherapy. This is something which is extremely important even after you go for a surgery. Because what happens is, I was just reading up and this came up, that various medical treatments can work wonders with endometriosis pain, but they often don't address what the doctors are coming up to understand as a secondary source of this discomfort. Something which you were saying, Vimee, that it's not always about the endometriosis that the pain happens.
Yeah,
it's a form of chronic pelvic pain called as high tone pelvic floor dysfunction. So this best understands as a result of pelvic floor self-defense mechanism in response to endometriosis. So pelvic floor physiotherapy is something you need to look into. Then comes the TENS unit, which is very prevalent now. It is available online, offline. That helps to reduce pain by stimulating your nerves. Take warm water showers. There's one thing which I would want to tell. A lot of people might not agree to it, because people are in pain. They'll be like, how do I do it? But even if you are in pain, try to exercise. Try to at least walk, because that is something which is going to help you produce the good hormones, good chemicals, and which is going to improve your mood, and also it will reduce the amount of pain that you're going through. If not extreme, you can just do walking, stretching, maybe some breathing exercises. Last but not the least, holistic approaches like acupuncture, meditation, and diet. Diet plays a very, very important role. So get into a low FODMAP, anti-inflammatory diet, and there will be a difference in what you are going through. But anything that you do, keep it consistent for at least 3 to 6 months. That's when you start seeing the difference. People do it for 15 days and they expect results. It doesn't happen like that. And just listen to your body. Don't be very harsh on yourself. Just love your body just the way it is. Don't hate it. It just shows otherwise. It just there's a lot of manifestation that shows up. So just love your body, and just say that you love it. It's as simple as that. So while this disease can be really draining and painful, both physically and emotionally, it doesn't define you. And just remember that you're not alone. You are valid and you deserve all the help and comfort which anyone with any other problem, needs. So there are people like me and Vimee who have been working hard to actually create the safe atmosphere for patients with endometriosis to talk. We do receive calls about endometriosis day in and day out, and we are there to answer questions and help you as much as possible. So that's okay. If you feel that you need somebody to talk to or something you need an answer for, just message us. I think we'll be happy to answer. So that's how it is with me. That's how I manage my endometriosis.
Yes,
There are questions.
Yeah. Mikala is asking, once we get pregnant after excision, is there anything more we can do to reduce the risk during pregnancy? For example, progesterone support, as endo is said to be estrogen dominant disease.
Yes.
So basically, once you have conceived either with assisted conception or you know that you have endometriosis, maybe your doctor will prescribe some progesterone support in the first 12 weeks of pregnancy, but usually after 12 weeks, it is not needed. So maybe first trimester, some support may be prescribed by your doctor, and that's absolutely fine.
Fine. How often does endo and Eddino go hand in hand, especially during mid-30s? Oh, stepsisters.
Yeah, in 30 to 40% of the cases, Eddino and endo may coexist. And she also asked, like, does mild endo affect pregnancy? Usually, mild adenomyosis may not cause frank infertility, but yes, subfertility or a combined factor associated with other factors may be responsible. So adenomyosis, which is little like kind of diffuse adenomyosis, or the uterus size is quite bigger, or it is a focal adenomyosis, that is more of a cause for infertility.
All right. Bhargavi is asking, I've been told I have adenomyosis based on 3 abdominal pelvic ultrasounds over last year. I have pain of varying intensities throughout the cycle. Is it suggestive of endometriosis?
Adenomyosis can exist alone or in association with endometriosis. The pain, what you are describing, can only be due to adenomyosis also. Now, your sonologist has to look properly for any associated pelvic endometriosis. As I said, 30 to 40% may have coexistent endometriosis also. So they have to look for it. But your pain can only be explained by adenomyosis also. Not necessary that you'll have adenomyosis. Endometriosis.
Endometriosis. Sheetal is asking, how can somebody dealing with something as difficult as endometriosis keep themselves?
You already answered.
Positive mentally, emotionally, physically. I think Sheetal sees that day in and day out. So Mikala says, thanks for speaking about depression. After being told it's all in the head and the pain being real, I ended up questioning my own sanity and now realized I was feeling sad. The pain was real, and just because it was not addressed, pain was manifesting itself by affecting. Absolutely, Mikala, just like I said, it plays on your head. It really plays on your mind. So try to just hold on to yourself and believe in yourself. Trust me, it is not in your head. It is just there, So if your doctor says that, please change your doctor. You need another doctor to really hear you out. All right. So it's been like a really nice session, and it was informative. It was very, very informative. And I hope we could answer most of the questions which came up. There were a lot of other questions, but I think the time wouldn't have sufficed. So we would keep answering all the questions on the comments and generally also in our sessions. So Vimee, thanks a lot for answering all the
Thank
questions.
you, Shilpa. You are always a great help to all the endometriosis patients.
Thank you so much. And thanks to all our viewers who have joined us on a weekday and who have supported us thoroughly right from the beginning. Thank you, everyone.
Thanks for sending all these questions because it helps others.
And keep pouring in the questions. Keep pouring in the questions. We would keep answering them.
We'll have to answer in the next session.
Yes. And thanks to everyone who's going to catch up the session later. And to all of you Endo warriors, just be strong. We're all there together. Yeah. All right. Have a lovely evening ahead. Take care and bye-bye.
Bye-bye.
Bye.